Gary, speaking from a personal note, I mean, you're an associate professor with the University of Queensland. You've been in private referral dentistry practice, veterinary dentistry practice, since the mid-90s, but you did begin your career in the 70s. What changes have you seen in horses' mouths over that time while you've been treating them?
Yeah, very interesting point, Shannon. That's a good point. The changes I've seen are probably more associated with my skill level as they've come up than actually being changes within the horse. Okay, the power to observe. One of the things we do know now is that we didn't know now. The most critical thing in dentistry is the oral examination. In fact, looking properly in the mouth, the same as our dentist does to us. You have to examine every tooth in every position and every surface of that tooth, looking for the possible pathologies that are there. We didn't do that back in the 70s for a couple of reasons. One, we didn't know we had to. It's our fault, but we didn't know we had to. The second thing is we didn't use sedation. And the sedation available back then, which was acepromazine only really for horses, it would have been totally useless as a drug to sedate a horse to do proper dentistry and oral exam. Horses resent oral examination. They don't like it. They don't like us putting that big speculum on the horse and opening it up. It's uncomfortable and they don't like it. So doing them without sedation was really quite a dangerous procedure for the operator, and in fact a lot of the time we didn't even use the speculum because you run the risk of getting smacked in the head from it, and if you get hit in the head with that, they have to get someone else out because you're in the hospital. Okay, so it doesn't work.
So Gary, you mentioned there people doing dentistry by pulling the horse's tongue out of the mouth or using various ways of trying to examine the mouth without a speculum. Could you just enlighten us a little bit about?
Okay. Examining a horse without a speculum and without a light, of course that's a component of it as well, and mirrors, we do all that sort of stuff, is not examining the mouth at all. It's as simple as that. Okay, you cannot examine a horse's mouth that's not sedated properly and not washed out with all the food out, without a light source, without mirrors and things like picks and stuff like that. You just can't do it. It's incorrect dentistry. What all the operators doing that are just doing that is they're doing a little bit of carpentry. Basically they're just filing some teeth, whether those teeth need to be filed or not, because unless you've examined that mouth properly, how do you know that's what you're supposed to be doing? Right? The examination is the critical component. The actual treatment isn't necessarily that hard sometimes. Sometimes it is, of course, but sometimes it's not. But it's got to be the correct treatment for that horse. Now back to the 70s, these horses were throwing their heads around, tossing. We had a twitch. You're getting dragged around by that. The horse is rearing up and striking sometimes. A very dangerous thing to do is grab the tongue and pull it out. If you've got a male horse with canine teeth, I have seen tongues completely severed by the horse's sharp canine teeth by someone holding it down over that tooth. In other cases, I've seen the horse actually bite with its cheek teeth because someone's holding that tongue right around the back. So a lot of trauma is done. That's not going to happen if the horse is correctly sedated and things like that. This day and age we have wonderful drugs. They're not foolproof, and in fact they require a whole lot of training, which veterinarians have, of course, in correct use of sedation. Sedation is not just having a needle, the horse stands there. The drugs we use are mostly things called alpha agonists. They can stop a horse's heart. Okay, and you can inject those and the horse can just have second-degree heart block and fall on the ground. There is a risk with that. These drugs can inadvertently go into an artery which is right next to the vein, and it can happen to any operator. That horse will start convulsing with that, and you need then someone to know what the hell have I got to do now when that happens, when it goes wrong. It's no sense. And just calculating the dose rate for an individual horse. Yes, it's associated with body weight, but it's also temperament that we assess that horse. Some are going to need a slightly higher dose even for their body weight than other horses, so a lot of that's there. So if we have the horse sedated, we see more stuff. And the major difference I see in horses from the 70s to now is that I'm actually looking and finding a lot of stuff that, and it's interesting because I've written a couple of papers, as has many other people, on the prevalence of diseases in the mouth, and of course we're suddenly seeing all these diseases. They were there back in the 70s. We just didn't see them. That was the problem. And of course, a lot of the horses that we were treating in Australia in the 70s were grazing. Right? And when I was in the Northern Territory, they were grazing very poor quality pasture. But most of those horses have very good mouths because evolution has designed them to do that with their head down on the ground in the correct position, not up here on a feed bin on the fence. and the teeth are lined up correctly, so the natural movement tended to keep away those nasty sharp bits and overgrowths and things like that. Now, some horses were parrot mouth back then and things, and they did get hooks and things, and that was still there. But the prevalence of diseases we see now, there's a lot of horses are stable fed for maybe 1 or 2 hours a day maximum, so they have to do all that in there. They're not wearing their teeth correctly. People are feeding them up on bins because they're worried about parasites on the ground, and that's a valid thing. There's ways around that, of course. But putting the head up, as soon as you raise the head up, the bottom jaw comes back slightly, the teeth are out of alignment, we start to get transverse ridge issues and a whole lot of other things like that.
So Gary, what is the ideal care, dental care, for a horse owner?
Okay. This is it's an interesting question because I get asked it a lot by horse owners and active riders and things like that. And it does depend on what you're using your horse for. Very big component. And that then is also modified by the age of the horse and breed of the horse. There are differences between different breeds. But ideally, the perfect world, if we look at a very young horse, they have, over a short period of time, they're going to erupt 40 to 44 teeth. And by the time they're 4 or 5 years of age. And this is a time when a whole lot of things can go wrong, and they need to be examined at least every 6 months through that period. Those teeth get very sharp and things like that, so they need dental care, looking at their mouth and correcting problems, not making problems. For example, if a horse is 2 years, 3 months and hasn't lost its caps on the first upper cheek, it's no big deal as long as they're not causing a problem.
Gary, you mentioned their caps. Would you just be able to quickly explain for horse owners who may not understand that term what a cap is?
Okay, a cap is the remnant of the baby tooth or deciduous tooth. So when our young horse is born, it's a set of incisors very quickly. Within 12 months it's got all its baby incisor teeth. But when it's born, in the first week of life, it has 3 cheek teeth as well. Now they're deciduous or baby teeth. They'll be lost, the same as ours are. We can't tie a bit of cotton and slam the laundry door like Grandma did to get rid of these. It doesn't work that way. But as the permanent tooth forms underneath them and comes up underneath, you start to get resorption of the root remnants of that baby tooth, and eventually, as the permanent tooth breaks through the gum, there's a little remnant of the baby tooth sitting on top, and it's like putting a cap on. And that's why it's historically in the horse, ever since people have been calling things in the horses, they've been called caps. And they then should, as soon as the horse eats something, that should just fall off and it should be lost naturally. Now occasionally they're not. Occasionally they're slightly off to the side, they get stuck in the gum, they get rotated, and there's a whole lot of reasons that your veterinarian knows when they should come off. But it's not just time, right? There's a whole lot of reasons that we do quite complex examinations to work out if caps come off. I've seen a lot of people just jump in and say, oh, that horse is 3, it can't have any caps now, and go and bang the caps off. And that immature tooth is then left underneath unprotected because it takes time for that to calcify properly, so they don't just come off of that. So that's our young horses. We've also then got the sharp enamel points that are forming, the same as any other horse that will come back to that. As the horse gets older, the teeth strengthen, they get harder enamel, right, and they go through a period where they're fairly okay. We'll come back to the frequency of examination in a second. And then they become older horses. And then they start to get the diseases of aged animals, which are periodontal disease and things like that. So there's a whole lot of issues that start to come up there. We modify all this by what you're using your horse for as well. So in that horse that's ridden once a week or once a fortnight when the kids have got time from their homework and things like that, once they've passed that 6 or 7 years of age, they can probably be examined about once a year, and they'll usually just need some sharp points taken off. That horse will be out there grazing in some grass, eating properly and looking after his teeth fairly well. If we take that same horse that's doing intense work, and we now shift up to a high-level dressage rider with a 7-year-old warm blood, now that horse needs to be examined every 6 months because we need to do what's called preventative dentistry on those guys. We don't want to be treating problems, we want to be stopping them, because if that horse starts head tossing in a competition because it's got one sharp point that just flicked the tongue, the horse starts throwing its head or dropping its tongue out, you lose the Olympic gold medal. It's as simple as that. Right? So those horses have to have the ultimate of dental care.
Right. Gary, you mentioned power instruments and your fear at the dangers of them in the wrong hands. Could you just, or being used incorrectly, could you just explain a little bit about that?
Yeah, there's two components of that. One is just physically taking away too much tooth too quickly. And that's very easy to do. Having said that, again, that takes those cutting things out. They should never be used. There's no reason to use those. But even the grinding equipment, you can take that tooth down too fast if you're not looking at what you're doing. So that can just physically take too much tooth off. You can make it to such a point where you smooth the teeth off. And if you take the whole surface of the teeth off in the molars, the grinding teeth, that horse can't eat. So as they're grinding away at their teeth, you can take that tooth down, you can smooth the tooth off completely, and if the molar tables aren't rough, they can't grind their pasture, which means the horse can't eat properly. If it gets too bad, it'll actually start dropping food because the tooth surface is smooth and can't function correctly as a grinding tooth. It has to be rough. Having said that, it can't have the sharp bits sticking out that are quite common in our horses that aren't out there grazing poor quality pasture for 18 hours a day in a nice big lateral excursion, which is why horses in suburbia or in better quality areas like this here have to have their teeth done routinely because they don't have to graze for 18 hours a day in poor quality pasture. You know, so with the power equipment we can get in very quickly to remove those sharp points if you know what you're doing. And it's in and out of the horse's mouth much quicker, so it's better for the horse and everything else. So power equipment is very good in that regard. Can be dangerous by taking too much tooth off. The other danger with power equipment is it actually heats the tooth, or what's called thermal damage. Now, teeth can't handle being heated up. The problem with the tooth, if you heat it up about 5.5 degrees into that pulp, the tooth will die. So holding on a power equipment that's not water cooled and being sorted out like that can be very dangerous if it's held on for longer than that. We actually did some research at the University of Queensland on that, and we're the published authority on that, and we know that you can't use those power instruments on an individual tooth for more than probably 10 to 20 seconds without taking it off and then cooling that tooth. Now, it doesn't mean we have to have water running all the time, which does annoy some horses, but we do have to keep wetting those teeth, cooling them down and things like that. So thermal damage is a nasty one. That tooth will die, but you won't know for maybe 3 to 4 years later that it's happened because of the way the horse's tooth erupts slowly over a long period of time. There's a layer of dentine over that pulp. You've killed the tooth, it's died. It's not until that tooth erupts far enough and slowly wears away in the mouth that eventually you'll see your pulp exposure. So you'll either see the hole in the tooth, a good operator will see the hole in the tooth, or of course worse still, you'll have an abscess tooth with a draining sinus out of the jaw or swollen face or something like that with the infection.
So Gary, just as a summary of dental care for horses of different ages.
Okay, back to our young horse. We want to be looking at them about every 6 months, especially around time of erupting teeth, so that we can look for problems that are developing there. We want to check the really young horse. I mean, the ideal world is we actually check the horse in the first couple of weeks of life because we want to see for some really important things like cleft palates and all that sort of stuff. But then roughly every 6 months up until it's about 6 or 7 years of age. We're taking the high performance horses out. We're going to keep checking them forever, remember that. Okay, we don't do that. But the horse that's not doing much, that's just sitting around in the yard and things like that. Once we get to that middle-aged horse, 10, 11, 12, that sort of thing, they probably only need to have their teeth looked at about once a year, right? And they'll have some sharp points and things like that, and hopefully nothing catastrophic. The whole overrider for any of that is, of course, when the horse was first examined, it does have some problem with alignment of teeth. That will change for that individual horse then. That'll have its own special program designed for whatever it's got, whether it's making hooks all the time or something like that. Then we get to the geriatric or senior pet. No one likes to be called geriatric anymore, especially myself. Okay, the senior pet, they're a different kettle of fish. They've run out of most of the thing we call reserve crown. So suddenly the teeth aren't erupting very fast anymore, right? And we've got to be very, very careful of what's done there. And if the practitioner or the dentist does the same level of grinding in a 22-year-old horse as they did in a 10-year-old horse, you could actually stop that horse eating and it may die. Right? And we see this all the time, unfortunately. They don't have much growth in those teeth. You have to be very, very careful not to take them down, even if they're getting wave mouth or something. If they're those old horses, you can't correct that at this age. We can get rid of all the sharp bits. We can actually make that horse very comfortable, but you can't turn it back to a young horse's mouth. You make a gap between the teeth, they won't work, of course. The horse can't eat, the horse will starve, and you'll lose your horse. So it's a really important thing that people don't over-treat those. The other issue with the geriatric, this older horse, is they get a lot of periodontal disease. They get what are called diastemas, gaps between the teeth, feed accumulates, gets caught there, it starts to putrefy, and they get infection in there, which is called periodontitis, same as all the periodontal disease. It goes way past gingivitis. And some of those horses will need extractions from time to time and things like that, and they'll be individual cases, and then they'll need some special care. Some of them will need certain mouthwashes, some will need other treatments for those diseases. So these older horses, they need to be examined fairly frequently, but not necessarily treated. We want to see what's going on. As I said, the most important thing with these guys is the sedation and the examination. And again, with the geriatric, sedation is very important that someone doing it knows what they're doing, because again, they're not a youngster anymore, and we don't want to cause other issues in those guys. And they often have concurrent kidney, liver disease, something like that, which makes it difficult to break down certain drugs, and we may modify our type of sedation with those older horses.